Hello, today I'm going to be showing you how to place an intracatheter sampling line using a peripheral catheter. There are two sizes of intracaths. You can use a 22 gauge by 8 inch intracath, which are blue, and then the 19 gauge intracath. These come in 8 inch for your smaller patients, or a 12 inch for much larger dogs. In order to place an intracath, you need to use a peripheral catheter that's 2 sizes larger than your intracath. So if your intracath is a 22 gauge, then you would use a 20 gauge peripheral catheter. And then for your 19 gauge intracaths, you would use at least a 16 gauge catheter to feed it through. Here I have the setup that you'll need in order to place your intracath. You have sterile gauze. I have a section for alcohol, a section for chlorhexidine, and some dry sterile gauze that I've opened up and prepared. I have my peripheral catheter. I'm going to be placing the 20 gauge with the 22 gauge intracath. It's a smaller dog, so that is my catheter choice. I have a syringe with T-port attached, which is not flush. This is completely empty, so that this way I can draw blood as soon as I place the catheter. I have tubes prepared, a serum top and an EDTA top. I have a flushed cap. This is a needleless port cap where you just twist this on, and I flush it to make sure that there's no air. This is a heparin flush. And then of course I have my tape prepared, as well as clippers. So I have my patient here. In dogs, we can typically use the medial saphenous or the lateral saphenous. Let me just see this one. Or the lateral saphenous. In cats, we typically use the medial, although if vascular access is otherwise difficult, you can always use the lateral. It's just a little bit more difficult in cats to get the lateral aspect. The good thing about using the medial saphenous is that it goes straight up into the inguinal region, whereas if you place it in the lateral saphenous, it's okay, mama, stay. This needs to go at an angle and kink upwards, and then when the dog moves around, it'll constantly kink the catheter, so it might occlude your fluids or medications. So I typically always go for the medial saphenous on my first try. I'll shave from the hock and get a good wide margin all the way around the leg. I'll then do my sterile scrub to prepare the site. So that was 3 chlorhexidine scrubs, and then I'll do 3 alcohol scrubs. I like to take dry sterile gauze and just dry the area after I use the alcohol, so this way the tape has a better chance of sticking to the leg. Can you pull her a little bit closer to me? Okay, and you want to have your assistant put their finger behind the knee here to try and stabilize the leg while also holding off. I'll take my peripheral catheter and place it normally. And I'll place a piece of tape to stabilize that catheter before placing the intracath. Okay, so that's stabilized. You have the leg? Mm-hmm. Okay. I'll take a piece of dry gauze and I'll place this under the catheter so that when I remove the cap, any blood that might come out will go onto the gauze and not the tape. The intracath comes with this needle attached where you can remove the needle, and being very mindful of the catheter, making sure that the catheter is intact, that it's not kinked, that it's not stuck to the stylet of the needle, and that it disconnects from the stylet within the catheter easily. Also, sometimes we get them where they come out from the bottom here, and then they're no longer sterile. So you can typically go to your administrator and let them know, and they should be able to get a refund on damaged sampling lines. So I'll make sure I hold my catheter in place. I'll remove my cap and I'll carefully insert the catheter, and I will slowly and gently feed upwards. Sometimes if you're getting resistance, you can manipulate the leg different ways to try and get it to feed. Your assistant can also try and massage the vessel and try and help move the catheter upwards. And now I've come to the point where my intracath meets my peripheral catheter, and I will just place this inside the hub so that it stays. I'll just clean any blood. I will place a second piece of tape to stabilize. And now this white piece is the stylet within the intracath that I will remove slowly. Again, if you get resistance, you want to be mindful of where you might get resistance. There might be a problem with the stylet in the catheter, and you don't want the catheter to break and be loose within the vessel. So now I attached my T-piece with my empty syringe, and I will just draw back, and now we get blood. I'll get the sample that I need. And now I'll take my flushed cap and I will flush the catheter clear of blood. Of course, being mindful with any cardiac patients we might have how much flush we flush through that catheter. I'll take my smaller pieces of tape and crisscross just like a normal catheter. And with these guys, since we have the two catheters back to back, it kind of makes the T-piece sit a little bit lower. So sometimes I'll just take a piece of gauze and my last piece of tape, And this is patient to patient, how you might change this. But I'll just cut a tiny slit there so that this way this sits comfortably, and now this doesn't put pressure on the patient's foot or cause a sore. And I'll just tape that in place. Most of the time with these patients, I'll leave the T-piece dangling so that this way it makes easy access, especially with more fractious animals. But in this case, we could tape it up if we wanted to. Otherwise, this just will hang loose. And of course, you just want to be mindful if your patient is moving around a lot and is stepping around in the cage. When placing an intracath with a peripheral catheter and setting up the treatment sheet for the patient, you want to make sure that you indicate what size peripheral catheter you use, as well as what gauge intracath you used. And then also indicate the location of the catheter, whether it be medial or lateral saphenous.